Hi guys, so I wanted to come on here really quick and go over her tongue tie. So as soon as she was born, the doctor told me that she was tongue tied. My son was tongue tied as well, and he didn't get it fixed till he was around 4. And I did notice that he did have speech problems, like no one could understand him besides like me because I was his mom. So I did want to go ahead and get hers taken care of as soon as possible. So I reached out to the same dentist that did Oakley's tongue tie and brought her in, and turns out she had 4 ties. I am exclusively breastfeeding, so I wanted to make sure that it was as successful as with my son. Oakley, hindsight being 2020, had a lot of colic, a lot of gas. He was upset for like 9 months straight, just a very unhappy baby. Hindsight being 2020, it was probably because he was tongue-tied and he was, getting so much excessive air, which turns into gas, which makes babies ridiculously upset. So that's what I battled with him. I obviously didn't know. I had no idea about this. No doctor was able to tell me. You usually do have to go to a dentist. So I was very thankful that at the hospital, the doctor, informed me that she was tongue-tied. And even the dentist was like, wow, she's amazing. Like, I need to find out who that doctor is, because so many people go so long, their whole life, without having any clue that they are tongue-tied. Even the dentist himself is like probably 30-40. He's in the process of getting his revised, and it's a lot better to get it taken care of at a young age. So that's why I went ahead and had hers done at 2 months old. You do have to go to a dentist. A normal doctor won't do it. It is kind of weird bringing a newborn into a dentist with no teeth, but they are professionals and they will be able to tell you if your baby is tongue-tied. So some of the things with tongue-tied babies, if you are nursing, is usually the best way that you'll be able to tell, because it's more hands-on. So your nipples will be more cracked or red, or just irritated in general. They won't get a good latch. They'll take in a lot of air. You'll hear like clicking when they're nursing, like smacking of their mouth while they're nursing. A lot of gas, upset. Basically, it's mostly like you and your latch. So a lot of people give up breastfeeding because their baby's not latching well. I do kind of remember when I was in the hospital, and obviously you have to wait for your milk to come in like 2 to 3 days after you give birth. I don't really remember that with Oakley, but this time around I definitely felt it, because she was trying to nurse and it was just frustrating her because she wasn't getting any milk. I almost broke down and gave her some formula, but I was just like, no, like we're just gonna have to power through it. And then after that, I nursed Oakley for a year and he was tongue-tied, so I just thought it was normal. The dentist was amazed that I was still breastfeeding with her having 4 ties, but I just thought it was normal. I had 2 tongue-tied babies. I later find out it's hereditary. I probably passed it on to them. So I just thought this is just how breastfeeding is. It's rough in the beginning, and then it, kind of eases out, and yeah, they'll get gas or whatever. But honestly, having it fixed, she's so much of a happier baby. So that's just my quick little tip for you guys. If you are having troubles breastfeeding, take your baby to a dentist and have the doctor evaluate them and see if their mouth is tied. That could be a huge problem as to why your baby's not latching properly, why it's hurting you. So definitely, look into that if you are having troubles, and just push through it. It was, kind of hard to wait for her appointment, but once we got it taken care of, it's like night and day difference. So if you are having troubles breastfeeding, or maybe you just gave up breastfeeding because it was just too hard, definitely still go and see if your baby is tongue-tied, because I would have no idea otherwise unless a professional told me, because it can still affect them later on in life, even if it's not with breastfeeding. Like, they can still have speech problems, food aversions, all these different things. They're sleeping, all that. So that's just my little tip. This is my journey, so I will go ahead and roll the clip.
Thank you. We're not screaming.
Yeah.
You happy?
You guys take your time. If you need anything, let me know.
Okay. Oh, I think I left my bag in there.
Oh, are you gonna need a boppy, Mom?
No.
Okay.
Got a nurse everywhere.
All right, we're at the dentist right now for her tongue tie. We're doing the revision, or like the follow-up appointment. So we'll see if anything reattached. I really hope it didn't. What do you think?
You scared? I don't think they're gonna do nothing again.
Okay, so basically with her tongue tie, she had 4 of them. So she had both cheeks, top and bottom. So I'll try to show you guys them if she'll let me. So this is what the top looks like. This is about a week after. Oops, sorry. And then in her mouth, in her tongue. Let me see. Ah, she likes to bite. Open. Ah, she's biting. Okay. All right, let's see that. Let's see under that tongue. Hey. 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 All right. Here we go. I think I got it. Hey. I have to do these stretches with her. Okay. So then they did underneath. So basically how they, I'm sorry. So basically how they explain it is they like do like a little laser. Underneath. I don't know if you can see that little scab under her tongue. So she was tongue-tied. Oakley was tongue-tied too, and we didn't know till he went to the dentist, and then it was the same dentist for this. So basically like the piece of skin that people usually have underneath their tongues, they go in there and like laser it out. So and she'll lift it up. You can kind of see underneath how like she doesn't have that. If she lifts it up, you can kind of see it. And then they did both of her cheeks. But I doubt I'll be able to show you guys that. So basically the doctor just took her away, and then I guess, I don't know, did a laser thing. Let's see if I can show you the top a little bit better. So like she had that, like her top lip, and then her tongue, and then she had both cheeks done. So they just took her away. I went and waited in the waiting room, and when I came back to grab her, she wasn't crying anymore, so that was good. I was really worried about that. And then they said that she did great, and then we went back to her 1-week appointment, and he said that none of them reattach, because we have to do like these stretches. Like I have to like stick my finger in here and like go like out like that, and then do it like this and just kind of swish it out, and then I have to lift the top one up. I know, I'm sorry. And then I have to lift underneath her tongue. So far the total procedure was about $250. We were gonna see if her insurance would cover it, but I just didn't even want to bother. Yeah. So tongue ties can affect like their talking, their speech, obviously latching for breastfeeding, and food aversions and stuff like that, and then also like their breathing when they sleep. So her and Oakley both had it. They both got it revised, and now she's tongue tie free. But the doctor told me when, I know. The doctor told me when she was first born that she was tongue tied, so that's why I got into it. But if you are breastfeeding and you think that maybe there's a problem with latch, the baby could be tongue tied. I wouldn't have known unless they like said something or I took her to like an actual dentist. I would not have known that she was tongue tied. I just kind of nursed through it. I do notice a bit of a difference now. She seems to like nurse a lot better, but I was just gonna power through it anyways. She's about 2.5 months old now. And then what else? Oh yeah, she had thrush. Yeah, we've been through everything. You had thrush. She had some type of like thing on her ear, and then what else was it? The thrush, they just gave her like some medicine for in her mouth, but we got that taken care of. And then when I went to my girl doctor, she was like, oh, you need to be on this medication too. So we both got treated for the like thrush together. And then I did just get the Mirena IUD put back in, because as cute as she is, I don't want to get pregnant back to back. I want to like enjoy her for at least 2 years, and then I want to have another one when she turns 2. So yeah, I think that's pretty much all the update. She is about 12 pounds now. Cute as a button. She's sleeping basically through the night. I am co-sleeping with her as well. She doesn't like riding in the car. She's really good at following, and her eyes are still blue. I don't know if they're gonna stay blue. Me and her dad both have brown eyes, but She definitely got her daddy's eyelashes and eyebrows. And she scratched her face a little bit right here. Oh, cross-eyed. So yeah. So we got my tongue tie fixed. So yeah, they basically like burn the skin with a laser. And it kind of smelled like burnt flesh when I got her back. But they said it's less invasive than circumcision. So whatever that means, I feel like circumcision was pretty invasive. So yeah, she is happy, healthy, growing. Very particular. And everybody, I was in the store yesterday and these people were like, oh my gosh, her toes, because like she does have really long toes, but so do I. But I was like in line checking out, and then like the people that were standing behind me were commenting on her toes and her feet. So you're gonna have big feet like mama. Yeah, and long toes. Oh, I know. You give us a smile? No. All right, we'll turn it off. Yeah.
They're taking photos, putting on a little more numbing. So here's what the numbing thing means for you. If you're trying to breastfeed or bottle feed, the numbness is it's all over the place.
Yeah.
It's just like they have no idea to process numb.
Yeah.
And it tastes gross sometimes, but it's just there. So be patient. 10 minutes of numbness is normal. 15 minutes is pretty normal too. So the upset cry when trying to hit and actually latch and stay is the numbness. But I'd rather be numb and comfortable and not be having pain than to have this wildly upset kid. Does that make sense?
Yes.
It's a trade-off.
And you don't have to worry about infection or anything.
Never been reported anywhere in the United States.
Okay.
There's one report from a kid that had cancer outside the country. That's a different story.
Yeah.
But like, now you'll see a white wet scab. So in the mouth, scabs on her hands, scabs are brown because they're dry and crispy. In the mouth, it's always wet and white.
Yeah.
So don't be surprised by that. Push harder on stretches than you think. So this is the tongue in my mouth. Like, here's the tongue, here's your little wound, it's a little diamond here. It's right at the fold. The body wants to scar tight from all directions. I want it to heal as fast as it can, like curtains closing on a stage, that's how I want it to heal. But I don't want it to zip close at all, right? So I don't want it to get any vertical limitation back. If it doesn't grow back, it scars tight. So what you do is, the reason you do stretches, it's not because you're a monster. Nobody loves stretches. They're no fun. You cried, she cries, everybody cries.
Yeah.
But I want it to heal so free that it's all worth it. That's the why. Otherwise you're just like, this is crazy, why am I doing this? Because the wound will zip back tight again. So every day, 6 times a day. Hey Ariel, will you muting the TV for me, if you can, please? Thank you. I know it's so hard to hear sitting under
She needs to know how to move.
Yes, but this is important, right? So you're like, here's why. Why am I doing this? Because once you believe in it, you get it done. And it's only really hard the first few days. It does get much easier day 4, day 5, day 6. But your little stretch is just to keep the wound as open as it can. The only thing back here is muscle. There's nothing you can break. You can't hurt anything. But if you allow the tongue to sit there, it's more uncomfortable, you have more inflammation, more pain, and it scars tight, so the whole thing's not as effective. It still will heal. Most people don't do stretches, and it goes all right. So you'll talk to moms, like, hey, we did a release, it's okay. They still have speech issues. Not you. You're doing stretches, it's fully aware, fully free, you're good.
So that's the main thing with tongue ties is the speech, like when they get older?
Older is speech, quality of sleeping versus open mouth breathing and tossing and turning. Closed mouth, tongue up, like right now, where's your tongue up? Sorry, you're fine. Up. Up. No, down. Mine's down, so I'm in the same class. But most people, when you're talking out, they teach us up. That's the suction. That's ideal. We're not wrong, but that's ideal. So typically that happens better, and you rest and sleep better versus open mouth breathing and snoring and tossing and turning, all this stuff there. And then textures and texture versions. Texture and texture versions. So like we're picky. Oh, flavors, everybody's picky. But if it's like, no, we don't need XYZ textures, that's what you improve.
And these are hereditary, like tongue ties are like.
The current thinking is that they're passed on hereditarily.
Yeah.
I think that's true. Like I passed on one to both my kids. I have a twin sister. All of her kids have one. I have an older sister. All of her kids have one, and my mom has one.
Did you ever get yours fixed when you were
I'm
young?
actually in process right now. I'm doing therapy. It's a long road.
How do you
Therapy
know
for
if you
2
have
months.
it, I guess?
It's malfunction. You can look at it. That's not the whole thing. It's like whether or not anything works, ideally.
Oh, okay.
Are you ready? Oh yeah, I can talk your ear off. Don't.
What? Oh.